Hello, good morning everyone. Welcome back to my YouTube channel. So in this video, we just discuss about the clinical using patient position. Okay. So this is a very important or a basic topic. You just go into the hospital, you seen a lots of patient, right? Our patient is suffering from different kind of disease. Okay. So that time, according to the patient condition, patient required different kind of position. Okay, there are various kind of surgery. Okay, so every surgery can require a different position. So this is a very important or a most basic things you have to learn what is the different kind of patient position. Okay, so now let's start the video. Okay, so first we discuss what is patient position. Okay, so positioning is defined as planning the person in a proper body alignment for the purpose of preventive, promotive, curative and rehabilitative aspect of health, or placing the patient in good body alignment as needed therapeutically. Okay, so positioning is basically for a proper body alignment or a provide comfort of the patient, or it can be help for the healing of a disease. Okay, so this is a basic definition of positioning. Okay, so now we discuss the purpose of positioning. Okay, why you have to provide better position according to the patient condition. So it can help to promote comfort to the patient, to relieve pressure on various parts, to stimulate circulation, to provide proper body alignment, to carry out nursing intervention, to perform surgical or medical intervention, to prevent complication caused by immobility, to promote normal physiological functions. Okay, this is a basic things you just read and understand, right? So now we just discuss the principle of positioning. Okay, so now it can maintain good body mechanics, right? Wash hand before and after procedure, right? Ensure patient's comfort, obtain assistant as required, ensure that mattress is firm and level of bed is at working site, right? And follow safety measure to prevent accidents, follow the systematic or orderly way of doing. If you are doing any things, okay, for the patient, then you just maintain the systematic way. Okay, so prevent the any kind of complication. Okay, so now we discuss the different kind of patient positioning. Okay, so now first you just see the image and see which kind of position is. Okay, what is the name of position, you just comment on the video. So this is a supine position. Okay, so this is the basic area where if you lay down, so feel more pressure. Okay, so back of the head, shoulder, like in a scapula blade. Okay, and elbow you feel the pressure, buttock, heel. Okay, so if you lay down for a long time, then you feel some pressure from these areas. Okay, so it can cause the stoppage of circulation, right? So it may cause the bed sore or a pressure sore, right? So this is a supine position. So what is supine position? Okay, so the patient lies on his back with his head and shoulder are slightly elevated. So indication, usual position or examination of chest and abdomen. If you are doing any surgery, or if you are just assessing the chest or abdomen, then most of the time you just refer to suggest patient lay down on the supine position, right? So I hope this is a very simple position you can easily understand. So now you continue with next position. So this is just opposite to the supine position, right? So this is a prone position. Okay, so if you lay down like this, so this side where you just feel pressure more. Okay, so at elbow, at chin, chest, reproductive organs, knee or toe. Okay, so now discuss what is prone position. Okay, so patient in which the patient lie on the abdomen with the head turned to one side and one small pillow under the ankle, so you can prevent the pressure or patient feel more comfortable. Okay, so some indication when you can suggest the patient, you just lay down on the prone position. Okay, so if patient just coming from post operative, okay, or after surgery, or if patient with pressure sore on the back, burned patient on the back or anterior part of the body, and injury and operation on the back, then you suggest please lay down on the prone position to relieve abdomen distension. Okay, so now this is a very simple things. So now continue with indication. Okay, so if patient having renal biopsy, okay, or examine the back, or the patient after 24 hours of amputation of lower limbs, then you suggest prone position. Okay, so coming to the next position, can you guess what is the name of this position? So this is a lateral position. Lateral position. Okay, so if you lay down, mostly people are sleeping in this position, right? So this is a lateral position. Okay, so if you lay down like this, so most prominent pressure are be in the ear, in the shoulder, in the elbow, okay, knee, heel. Okay, so now what is lateral position? Okay, so we just small my picture and continue. Okay, so lateral position, the client lie on the side with weight on hip and shoulder, or the patient lie on his side with both arm forward and his knee and hip flexed. Okay, upper leg is flexed more than the lower legs. Okay, one pillow is given under the head, back and front to support the arm and abdomen, right? And a small pillow is given in between the knees. You just see the image, and what you just read, you just see in the position everything is there or not. Okay, I hope everything is there. You just by the help of drawing, okay, one pillow is there for the better comfort. Okay, reduce the pressure or friction, or one pillow is there so patient feel more comfortable, and one pillow is there so not feeling the pressure on head. Okay, so this is a simple lateral position. Okay, so now we discuss the next position. So next indication. Okay, indication of lateral position, patient who require periodic position changes in immediate post-operative patient, used for examination of perineum, inserting suppository just basic medicine insert through the anus for the cleaning of rectum or a sigmoid area. Okay, for taking rectal temperature, giving back care, or for giving enema just similar to the suppository. Okay, for cleaning of rectum areas, and colonic irrigation means washing, okay, by the help of medicated solution. Okay, so now we discuss the next position. So can you guess what is the name of this position? So I hope you just guess, this is a lithotomy position. Okay, so what is lithotomy position? The client lie supine with hip flexed, leg are separated and thigh are flexed. The patient buttock are kept at the edge of table and legs are supported by steps. You just see the image. Okay, legs are supported at steps and hips are lay on the table. Okay, so when this kind of position will be suggested by a doctor or a nurse, if patient during delivery of baby, or a rectal examination or surgery, or a vaginal examination, or hysterectomy means removal of uterus. Okay, in this situation or in this condition, we just suggest you just lay down on the lithotomy position, right? So now we discuss the next position, that is dorsal recumbent position, just a little bit similar to the lithotomy position. Okay, so a patient flexed his knees and his foot placed on the bed, not on the table or a step. Okay, so this is a dorsal recumbent position. Okay, So patient lie on back, knee fully flexed, thigh flexed, and externally rotate feet flat on the bed. So in this position, client with painful disorder are more comfortable with knee flexed. Okay, this position should not be used for an abdominal assessment because I promote contraction of abdominal muscles. If your knee flexed like this, na, so your abdominal muscles will be contract, so that time you not proper assessment of your abdomen, right? So that time you just avoid this position. Okay, so now what is the indication? If you used for catheterization or vaginal dutch or vaginal or rectal examination, okay, catheterization is a new word for you. Okay, so you just go for a clinic, then you easily understand, like one and third patient having catheterization like Foley's catheter. Okay, so Foley's catheter is a catheter which will be inserted through the penis, or for a girls inserted through a vagina. uh, okay, so it can be if patient not able to proper urine out. Okay, so that time you just insert the catheter. By the help of catheter, urine will be comes out. Okay, I hope you just basic idea about the catheterization, like Foley's catheter. There are different kinds of catheterization. We just example only one, like Foley's catheter. Okay, so it is also used for a vaginal operation or insertion of tampons. Okay, vaginal operation, that time you also provide this position, or insertion of tampons. Tampons just me a small strip things placed in the rectum or placed in the vagina for the collecting the blood or extra fluids during the menstruation time. Okay, so yeah, so now we discuss the follower position. Okay, so follower position is a very important. Okay, most of the patient, okay, one half of the patient will be suggested by a doctor. You just lay down on the semi follower, high follower. Okay, follower position. So this is important. What is forward position? Okay, it is sitting position in which the head is elevated at 45 to 60 degree. Okay, and the client knee are slightly elevated by the help of, you just placed below the knee one pillow, so knee will be elevated. Avoid pressure on the popliteal pressure, so pressure will be avoid. Okay, so back rest and two pillow are used for the back and head. Pillow can be used to maintain natural alignment of the hands, wrist and form, right? So these are basic things you just understand by the help of image. Okay, so this is a patient. Okay, if this is a patient, so if patient is lie down on 45 to 60 degree, so that time you just called follower position. If patient is lie down on 30 degree, your bed is just elevated at 30 degree and patient will lay down on the bed, so this is a semi follower. If angle is 45 to 60, that time you just called follower position. If angle is 90 degree, so that time you just called high follower position. Okay, so I hope you just easily understand by this image. Okay, if patient is 90 degree, if lie down like this is 45 or 30 degree. Okay, so continue with next part. Okay, so this is a high follower position. Okay, because angle will be 90 degree and pillow will be provided below the head and just below the hip. Okay, and one foot step will be there, so prevent the foot drop. Okay, so this angle will be 45. So which position, please write in comment. Okay, so indication for a follower position. Okay, a patient suffering from dyspnea. Dyspnea means difficulty in breathing. If patient having more cough, continuous cough, okay, or sputum will be coming out, or patient suffering from asthma, TB, pneumonia. Okay, or after surgery, if any surgery on the chest or abdomen, that time patient is also not able to breathe. Okay, so oxygen will be provided by the nurses. Okay, so that time we have provide patient will be laid on the follower semi-follower position. Okay, so to improve circulation, to relax the muscles of the abdomen, back and thigh, okay, to relieve tension on abdominal stature. Okay, that time you just provide forward position, semi forward position. Okay, so now what is the procedure for providing for a better providing forward semi forward position, because this is a very important topic. Okay, first we explain the procedure why you just provide forward position or a semi forward position of the patient, and then elevate the head of the bed at a proper angle like 45-60. Okay, and rest the head against mattress or a small pillow, so prevent the pressure. Use pillow to support arm, right? Place a small pillow at a lower back for a better comfortable. Okay, right? Place foot board. Okay, so prevent the foot drop at the bottom of the patient feet, as you can see the picture. Okay, place the patient in sitting position with arm at side and knee raised with pillow. Right, so this is the procedure for any patient. You have to provide any kind of follower semi-follower position. Okay, so that time you just uh, follow this stepwise pattern. Okay, so now we discuss the next position, that is Sims position. If you lay down like this, I know some of the most of the people, if in a dreaming condition during sleeping time, this position will be common, right? So if your leg will be flexed, your arm will be placed like this. Okay, one arm is behind the body. Okay, so this is a Sims position. Okay, so Sims position, in this position the client lie on either the right or left side. Okay, lower arm behind the body, of course. Upper arm is bent at the shoulder and elbow, and one pillow will be provided for the comfort. The knee are both bent, of course, with the uppermost leg more accurate bent. Okay, this position similar to the lateral position. Okay, so now indication why this position will be important. Okay, so vaginal or rectal examination time, administration of enema suppository. I already discussed enema or suppository is a medicine which inserted into the anus and just identify or assess the area of rectum or a sigmoid colon or a lower colon, right? Used for relaxation in antenatal exercise. Okay, and position for sigmoidoscopy or protoscopy. Sigmoidoscopy is a thin tube just insert into the anus. You just easily understand by this image. Okay, insert into the anus and just assess the colon area, rectum, sigmoid areas. Okay, if patient having any kind of polyps or during hemorrhoid, okay, or any kind of cancer cell are there, so that time you just assess the area. Okay, so this is a new position, that is Trendelenburg position. This is also an important position. So in this position patient lie on the back with the head low. Okay, so normally bed is like this. Okay, and you just lay down straight. Okay, if your head portion will be laid down, so your leg will be elevated. Okay, so blood circulation will be better, or blood will be coming into the brain easily. Okay, so this is this uh, Trendelenburg position basically when patient is suffering from shock or any different kind of emergency situation, so brain need more blood. That time you just elevate the leg part of the any ki lower part of the bed at a 45 degrees Celsius or a 30, sorry, at a 40 degree or a 30 degree. Okay, so it can help for the better circulation, right? So I hope you can easily understand what is Trendelenburg position. Okay, so indication when used Trendelenburg position, used in emergency situation like shock. Shock will be different kinds, means just you just easily understand loss of blood, excessive loss of blood. Okay, so hypovolemic shock, cardiogenic shock, neurogenic shock. Okay, hemorrhage condition or hypotension, postural drainage time, or a patient with deep vein thrombosis. That time you use this Trendelenburg position. Okay, so now we just discuss the next position, that is knee chest position. Okay, so in knee chest position the patient rests on the knee and the chest. The body is at 90-degree angle to the hip with back straight and arm above the head, okay, and head is turned to one side and abdomen remains unsupported. You just read and observe the picture, you easily understand. Okay, knee chest position. Okay, what is the indication when you have to use this position? Used for vaginal or rectal examination, used in first aid treatment in cord prolapse. Cord prolapse, you just understand, during pregnancy, during delivery time, sorry, during delivery time, fetus umbilical cord just comes out through the cervix, so it might be lapse. So this kind is known as cord prolapse, okay, or a retroverted uterus, okay. Uterus location will be just opposite or towards the spine, that time you just called retroverted uterus, okay. So an exercise for postpartum or a gynecological patient, that time you suggest knee chest position, okay. So now you discuss the next position. This is an important position, like orthopenic position, okay. So high follower position, you have just heard, patient will be laid on at a 90-degree, okay. So that time you just provide one bed table and patient his both hand lay down on the table, just uh, below the hand you just provide one pillow, so patient will be easily placed his hand on the table, okay. So why this is important, okay. So you just read, okay. So indication, patient with severe dyspnea means difficulty in breathing like asthma, pneumonia, TB case, or a cardiac patient, or position for thoracentesis, okay, I will explain, or patient with chest drainage tube, okay. If thoracentesis means if you patient having inside the pleural cavity of the lungs, okay, fluid accumulation will be there, okay. Because of the fluid accumulation, okay, lungs will not able to expand, okay. So it can difficult for a breathing, okay. So that time you just need to remove out the fluid from the pleural cavity, right. So patient will be able to proper breathing, lungs will be expand, okay. Because of the accumulation of fluid might be infection will be there, okay. So you just remove the fluid from there, okay. So you have to remove fluid from there, that time you suggest this position and insert the injection there and remove the fluid, okay. I hope you can easily understand, okay. So I hope you can understand the video, okay, and you can better understand the position of patient in hospital or in a different kind of situation, okay. So thanks for watching my video. Please subscribe my YouTube channel. If you have any doubt, please comment on the video, and if you want to make a new video, okay, so just suggest the topic, I make the video, okay. तब तक के लिए हंसते रहिए, मुस्कुराते रहिए, मिलेंगे नेक्स्ट वीडियो में, तब तक के लिए हैव अ नाइस डे।